Namaste, ladies and gentlemen. Feminism isn't about making women strong. Women are already strong. It's about changing the way the world perceives that strength. On that note, on behalf of HCG, I wish all the women a very happy International Women's Day. Today, here at HCG, we have an amazing panel of senior oncologists gathered here and will be talking on cancer incidence in women, both from their experience of treating patients over the last decade and from the current trends of spread of this disease. They will also talk about the importance of overall well-being in women and the steps that women should take to prevent cancer and to ensure holistic well-being. Let me introduce our first panelist and also moderator of this panel discussion, Dr. Vishal Rao. Dr. Vishal Rao is the Group Director of Head and Neck Surgical Oncology at Cancer Centre, Bangalore. He is also the Dean for the Center of Academic Research, HCG Care, and he is a key robotic surgeon of our group. Welcome, sir. Our second panelist of this panel discussion is Dr. Abhilasha Narayan. Dr. Abhilasha Narayan is a senior oncologist, consultant, gynec oncology, robotic and laparoscopic surgeon at HCG Cancer Centre, Bangalore. Welcome, ma'am. Our third panelist of this panel discussion is Dr. Kritika Murugan. Dr. Kritika Murugan is a senior consultant, surgical oncology with specialized interest in breast cancer and oncoplastic surgery. Welcome, ma'am.
Thanks very much.
Our fourth panelist of this panel discussion is Dr. Mahesh Bandimegal. Dr. Mahesh Bandimegal is a senior consultant, surgical oncology, specializing in breast cancer, robotic surgeries, and oncoplastic surgery. Welcome, sir. Our last panelist of this panel discussion is Dr. Roshni Dasgupta. Dr. Roshni Dasgupta is a consultant, medical oncologist, and has treated several women cancer patients suffering from breast cancer, lymphoma, multiple myeloma, and lung cancers. Welcome, ma'am. Without any further delay, let us get into the panel discussion. Over to you, Dr. Vishal.
A very good morning to all of you. And at the outset, wishing all the women here a very happy International Women's Day. So today, very interestingly, the theme for the International Women's Day is fixed by the United Nations as Gender Equality Today for a Sustainable Tomorrow. A very interesting topic that they have brought out. So I wanted to talk to Kritika and ask her perspective. How is it to be a woman surgeon and how does she inspire more women surgeons?
Hello everybody. First of all, a very warm welcome to all of you all. You've taken out time from your busy schedules to actually come here and be with us. A very happy Women's Day to all the women out there, and a very happy Women's Day to all the women in men's life as well, who made you what you are today. You know, when I was given that topic and you said I'm amongst the 3%, there's Shalini there, she's a surgeon as well, Dr. Abhilasha here. I wasn't happy or proud or elated in any way. On the contrary, I think it's quite appalling to find out that in today's day and age, we still constitute only about 3% of the total surgeons that the world has, or India has rather. Why do we have the bias? Why do you think women don't take up surgery? The first thing that you said was a surgeon. The term is always associated with a man, a tall, well-built, who walks in with his attitude and ready to cut. The surgeon's knife doesn't tell you that I will work only in this particular gender's hand. The surgical skill doesn't tell you that I'll work only with this community and not with any other community. Surgery is a form of art. It's nothing less than poetry. When you hold your forceps and your needle holder, it's a very lightweight instrument. You don't need brute force to hold that. And what you create after suturing a scar is something very beautiful and artistic. And that's the way I look at it. It's a skill. It's a science. And definitely, none of the specialties tell you that I will work only with it will work equally well in a woman's hand. In somebody with an LGBT community's hand, it doesn't differentiate genders in any way, and I think that is breaking the bias. When you get out of that mindset that only men can do this, or one particular gender can do this.
Request Dr. Mahesh, aspect of how we are looking at it in oncology from his perspective. Now he is a male surgeon who is treating, and one of his core expertise in surgical oncology is in breast oncology. So how does this aspect give a dimension of gendered innovation?
This innovation, gendered innovation was originally thought by Stanford University, who want to promote it actually. So basic idea is for any innovation or for any project, any whatever it is, if you have a mix of both gender, then the innovation is more sustainable and it's maybe more effective and more successful. Even they have tried in drug trials also, they found if it is dominated by one gender, almost 90–80% of the trials fail, because if it is gender equality is there, then there is chances of more success in those fields.
I'll invite Dr. Roshni Das Gupta now.
So empathetic design is definitely is the first step that can be taken so that a mere transactional consultation is converted into a more healthy and a more more healthy relationship between a healthcare provider and the patient himself or herself. And it begins with honest and clear communication between the healthcare provider as well as the healthcare seeker.
I'll now come to Dr. Abhilasha Narayan. So can you elaborate a little bit about cervical cancer, the myths around it, and break the bias in the mindsets of people on how we can prevent cervical cancer?
I feel cervical cancer is the only cancer, or maybe one among a few cancer, where the cause is known. So you can target the root cause, so you can prevent it. And I will not be wrong in saying that it is a preventable cancer. I don't think so you can use this word to any other cancer. With all the panelists sitting from head to toe here, this is the only cancer which can be preventable. Why? Because 99% of the cases it's caused by a virus, and we can target that virus even before it infects you or after it infects you, because there's a long gap between the viral infection and cervical cancer formation. It can be as long as 10 to 30 years. So you have 10 to 30 years for any women to please take some self-care and go out and treat yourself so that cancer won't develop in the long run. That's quite a long time that cancer does give you, the virus does give you. So WHO actually in 2020 has set up a target to eliminate cervical cancer globally. And for each country it has given certain targets to reduce it decade by decade. So for the next decade, actually this was little temporarily stopped because of COVID pandemic. I think now we have to like restart it. The thing is, always it's by prevention. So treatment everybody will give. Once you get a disease, there are all standardized treatments, novel treatments. But the now here is concentration is at elimination. For elimination, you have to prevent. You have to prevent the disease from coming, or prevent the infection from coming. So these are all primary prevention methods. And that's why WHO, the target which it has given to all the countries is something called 90-70-90 by 2030. By 2030, in the next 10 years, actually this target was started at 2020. So what it tells the countries, by at least by the next decade, make sure 90% of all the girls, adolescent girls, are vaccinated. Make sure at least 90% are targeted. Coming next is 70, at least 70% of women between the ages of 35 to 45, at least twice they are screened. Is at least the catch hold of 90% of all the women, treat them as early as possible in their either a pre-cancerous stage or a cancerous stage. So what this target actually means is the country itself has to form a policy of vaccination, a policy of screening, and a policy of treatment access to people who are in remote areas. That is how I think the WHO has told the countries, and I hope all countries do some health policies for vaccination. Maybe after COVID, maybe people will trust vaccine more. Australia has already started this vaccination policy, and now though they are almost, they say 70 to 80% are already vaccinated. By 2030, they themselves have targeted for cervical cancer elimination. And now though they are not even screening with pap smear, they are screening with HPV DNA testing only once in 5 years. Why? Because most of them are now vaccinated. So
thank you very much for covering this aspect. What are the chances of hereditary incidences in breast cancer patients?
That 10% which runs in families, only about 4% is transmitted via the BRCA1 and 2 gene. You must have heard about it because Angelina Jolie made it a big deal, you know, and she underwent a prophylactic mastectomy and oophorectomy. But it does, if you do carry that gene, your risk of breast or ovarian cancer goes up from 18 to 34%. So it does increase your risk. Whenever somebody comes with a family history, we draw a family tree out. There is a genetic counselor who takes your extensive family history, finds out if you are actually at an increased risk of any form of cancer, and offers you tests appropriate for that to find out if you have any of the mutations. And then it's a debate about what do we do for prevention, what sort of steps do we take. Is it about preventive oncology, or should we be offering you more surgery in the form of surgery on the other side, so taking a few other organs out and things like that. But yes, but hereditary doesn't form the basis of all cancers at all. It's only a part of the whole spectrum.
The second question is vaccination foolproof for preventing cervical cancer? Any other ways to prevent cervical cancers?
Similar to COVID vaccine, I need not educate everybody. COVID vaccination doesn't prevent infection. Even if it causes infection, probably it will be mild. Similarly, there are a lot of studies now which have come. Once vaccinated, they have studied these girls for over 10 to 20 years now since the launch of the vaccine. They have definitely found decreased incidence in precancerous and CS cervix in this population compared to general population. So the studies itself have proved, but theoretically speaking, along with that, not only infection, see, just because you have infection, you will not have the disease. They say only about 5% of persistent HPV infection out of 100, if only in 5 a persistent HPV infection, in that also 0.5% will develop cancer. So there are additional factors which contribute to it, like unsafe sexual practices, concomitant sexually transmitted diseases if they have, like HIV, other gonococcal infections, promiscuity, that is like polygamy, not using condom protection. Along with that, they say cigarette smoking reduces your local immunity, which causes vulval cancer also, along with oropharyngeal and cervical cancers. So I think safe sexual practice is one of the thing which is a major contributor for prevention of cervical cancer, along with personal hygiene.
There's a question, how does diet and nutrition play a role in prevention of cancer? Can you elaborate a little bit?
There has been a lot of research, especially when I think about it, there has been a lot of research, especially in breast cancer, where they show like the ERPR, the hormone receptor positive breast cancers, they are often the diet containing more of phytoestrogens or animal proteins probably augments the cancer growth. But there is a lot of research going on, a lot of nutritional advices that has been provided from very big global institutes like MD Anderson's, and they have said that the benefit of a good nutrition to the normal cells of the body outweighs much more than the risk that a diet can certain diet can cause cancer growth. Apart from that, yes, there are certain diets which are known to be more carcinogenic than others, like red meat or smoked food. Those are known to cause colon cancers as well as breast cancers to some extent. So dietary and healthy lifestyle definitely is one of those things which can contribute to a better health by in the form of prevention of cancer as well as during the course of treatment of cancer.
The most important aspect is diet and nutrition is important. So despite that, more amount of fruits, vegetables, more amount of nutrition and not just empty calories is what we need to improve our immune system.
Plus, it's one of those factors which is under your control. There are lots of factors which cause cancer which are not under your control. You can't control the aging process or your genes in any way. But diet, nutrition, smoking, alcohol are in your hands.
Thank you.
When you say, we have to we should take the self-initiative to go and get checked ourselves. But one barrier idiyala, going to a doctor.
Break the gender barriers. You should not expect male to break the gender barrier. I think you should first break that barrier. You should come out, educate yourself, awareness. Awareness only will make you take care of yourself. That is how you go to a doctor, you get yourself screened, vaccinate your children, advise others, neighbors, rather than talking what happened to a cancer patient. don't take this treatment, don't take, rather I would suggest you to actually go into prevention modality rather than see others who are suffering and retrospectively think of something else.
Thank you very much.
Hi, thank you everybody for coming here. It's been a very heartfelt, emotional session and very insightful as well by our doctors. I think cancer is probably the toughest battle that any patient has to fight. But what I heard today, we all heard today in the discussion of our doctors and then especially from all of you is that through correct diagnosis and timely diagnosis, treatment and a lot of positivity, determination and strength, this battle can be won too. We at HCG hospitals have been for the last 2 decades have been striving to give excellent care to all cancer patients here through our multidisciplinary clinical approach, by providing expertise by our doctors and world-renowned high-class, high-end technology that we have here. I am happy to say that we have so far in the last 2 decades treated over 1 lakh female patients. Today I am so proud to have felicitated you all here, our brave cancer survivors, these women that we saw and we heard today. Now, taking a step further, I think to create further health awareness among women, empowering women to take responsibility of their health, to make the right health decisions, to understand their health options better, and also to be able to get correct and timely diagnosis and testing, which then leads for the right treatment and the right clinical expertise. We have launched a preventive cancer package over here, specially crafted and designed for women. The basic package here includes clinical examination by oncologists, which is for screening, orientation, and basic diagnosis by our doctors. It includes pap smear, mammogram, blood marker tests, and then we have subsequent gold and platinum packages, which also include genetic counseling and genomic testing. We are continuing our strive to solve the problem of cancer in the country by ensuring prevention and diagnosis and testing and correct and precise treatment for patients across India. I once again thank everybody for coming here today and participating. The theme of International Women's Day is Break the Bias. So I want to invite all our patients, brave cancer warriors here along with our consultants to click a picture with the theme in this pose, and wish everybody a happy International Women's Day. Thank you.
On this International Women's Day, I am very happy to say that HCG Hospital has brought a woman from me who is very valor and vigor, and after completion of my cancer treatment, I am still back. I am on my legs. I am happy to say that I am back with the same happiness as I was before. Very happy Women's Day to all. Thank you, HCG Hospital.
International Women's Day, I say that everybody should go in for a checkup, which I had neglected for myself, and you catch it earlier. You don't have to go through such a long treatment then.
ಇವತ್ತು ನಾವು ಅಂತಾರಾಷ್ಟ್ರೀಯ ಮಹಿಳಾ ದಿನಾಚರಣೆಯನ್ನು ಆಚರಿಸ್ತಾ ಇದ್ದೀವಿ at HCG. So wish you all the beautiful women out there a very wonderful Women's Day. All these days I used to believe that early detection will be the key for the treatment when it comes to cancer care. But HCG has gone one step ahead and they have launched this preventive cancer care specifically for women, which is a very wonderful initiative. I congratulate HCG and the entire team on their initiative. I wish them all the success in this journey. Thank you.
सबसे पहले आप सभी को हैप्पी वुमेंस डे। और आज मैं HCG हॉस्पिटल में हूँ और आज यहाँ पे जो एक प्रिवेंटिव कैंसर स्क्रीनिंग पैकेज लॉन्च किया गया है वुमेंस के लिए, जो कि मुझे लगता है हम सभी वुमेंस को डेफिनेटली करना चाहिए। हम लोग डेली दौड़ भाग में अपनी हेल्थ को जो है ज़्यादा ध्यान नहीं देते और आजकल के टाइम में बहुत ज़रूरी है कि हम उसका खास ख्याल रखें। मैं खुद ब्रेस्ट कैंसर सर्वाइवर हूँ। मैंने अपना ट्रीटमेंट यहीं HCG हॉस्पिटल में लिया है। बहुत अच्छा ट्रीटमेंट मिला है। मुझे हमेशा यही लगा कि मैं बहुत सेफ हाथों में हूँ अगर मैं यहाँ पे हूँ। धन्यवाद।
I thank HCG, team HCG, for being so supportive, and today I am a Centurion blood donor with 44 STP donations so far and 56 whole blood donations. On this International Women's Day, where the theme says beat the bias for gender equality, I think this hospital has supported me to beat the bias really and become an STP donor. Thank you HCG for all the support, and I wish this support continues in future too.